Thank you. Thank you, everyone. Thank you, everyone, for joining. We want to make it a short, sweet session, and I hope you will find it useful. The couple of people, as I said, who are joining, and I want to acknowledge Mr. Paul Patel. He's the president of NZICA. So thank you, Paul, for joining. But sabse pehle, we all know about the corona. I think it's our cousin now, Miss Corona. I do not know why we are being a bit sexist here, but let's take it with a pinch of salt. We have some very, very great, very lovely healthcare professionals who have joined us. Or I want to make it very interactive. So what I'll do is I will start off with a session introducing none other than Dr. Singh. So I call him SP, and he says that's the way he likes to be addressed rather than Dr. SP. So just a little bit of an intro of this magnificent person whom I've had the privilege of knowing since last couple of years, I think now. He's an alumnus of the Armed Forces Medical College, Pune. Kaun nahi janta us institution, but it's one of the premier institutes of India. Dr. Singh has been a physician, teacher, researcher for 29 years now. Having retired from the army in early 2020 as faculty at IAmNZ, Rishikesh, he saw the effects of COVID on individual patients and the world unfold over the last 2 years. And I'll leave it at that. There's a bit of a suspense. So we'll talk. There's so much more to him than what I have just mentioned. So what I would do now is just opening up the floor, because we are all connected with India, Bharat. So we would like to hear a few words from you, SP. And before I get you on, I want to acknowledge the presence of Samir Sinha. Thank you, Samir, for joining, and we'll talk about you later. Unfold over the last 2 years. Samir for joining. So, SP, if you could unmute yourself, please.
Yes, thank you, Dr. Primla, for that magnificent introduction. And namaskar to everybody here. I'm in New Delhi, India, and I'm sure all of you would have some memories of this place. Well, most of you. And yesterday Primla contacted me saying that she'd like me to talk about our experience with the Omicron variant of COVID here in India. And as we all know, India is a country with a huge population. So whenever any infectious illness occurs, even if it infects fewer people or it is not too pathological, that means not too dangerous to the individual, yet there's always this chance of having a large number of people being infected by it. And whenever large numbers are involved, yes, doctors are naturally worried because there are a whole lot of people out there in the population who have various comorbidities or simply the elderly. So these people are more likely to suffer from any infection or more likely to have poorer consequences due to any infection. So after having seen the first 2 waves of corona in India, last year in 2020, when we were still learning about what COVID could do to us, and in August, September, October last year especially, we had this whole huge wave of COVID, although I really wonder if they called it a wave. But we had large numbers of cases. I was in IAmNZ Rishikesh at that time, and we had wards and wards and ICUs full of these cases. The good news was that only up to 20% of the people needed hospital to consult a doctor. 80% were asymptomatic. Of those 20%, barely 3 to 4% had to be admitted, and of those 3 to 4%, the mortality was hovering anywhere between 0.8 to 1.2. Those were our institutional figures in IAmNZ Rishikesh. So we were bothered, but not too much, because as you would all know, in the population with comorbidities and in those who are especially above 80, even a normal viral illness is very dangerous. The normal winter flu is very dangerous. This appeared to be somewhat like that, of course, with a greater RO number. It was spreading more rapidly. So that was the concern. Masking, social distancing, keeping our elderly safe. The whole idea of at that time that we gathered was that it had to be controlled at a public health level, at the level of the society, at a social level, and we would be fine. And then along came Delta, which forced us to have a relook at our ideas and our philosophies. And although Delta was equally, I think, infectious, not too much more than the earlier variant, but Delta was bad because it caused a lot of severe infection in a large number of people. We got so many more cases in contrast to countries like Italy, Spain, USA, where they had got long COVID cases after the first wave. In India, thankfully, we'd not had too many long, or maybe we were not aware. But after the Delta variant, we got a lot of long COVID cases. We still have patients who are suffering the effects of a Delta infection that happened in April or May last year. And of course, the infection itself, well, it's no secret that our entire healthcare system was overwhelmed. Our hospitals were crowded. We turned emergency departments into wards. We were temporizing, trying to get oxygen, trying to get drugs. It was rather bad. And I guess that was partly because of the suddenness with which it happened. Going up to March, early April, we were pretty sanguine, comfortable, happy with life. Things appeared to be under control, and then suddenly the thing burst. Well, that was the Delta, leaving hardly any family untouched. People lost in every family. So after the Delta wave, things did settle down, and life was almost back to normal before we heard of the Omicron variant, and back we went. But thankfully, this time we were better prepared. Our policymakers were better prepared. We were better prepared. And of course, we were better prepared because our policymakers had been better prepared. Arrangements had been made for bigger hospitals to be set up. Hospitals had been set up, more oxygen to be available, vaccination to be available. And of course, a huge difference that happened between the Delta and Omicron in India was that vaccination had occurred in a large part of India's population. I think about 50 to 60% of India's adult population older than 18 years of age is double vaccinated today. In contrast to figures of less than 10% in April when the Delta variant. Anyhow, so with the vaccination, and of course, the certain things that have become habit to people. I'm sure you all remember the crowded railway stations and the queues at counters to buy tickets, whether it be the bus stand, the airport, everywhere. Whenever we Indians form a queue, we don't just queue up in the mind, he's first, I'm next, this guy is after me. We queue up real close. We like to be close up together. All the pushing and jostling, right? You wouldn't want बीच में मक्खी ना चली जाए हमारे बीच से. इंडिया में ऐसा नहीं हो. अब हम मक्खी जाने की जगह छोड़ देते और कभी-कभी मक्खी से ज्यादा. तो आदत बन गई. तो आई थिंक उससे भी फर्क पड़ा है. RO number तो बहुत हाई है. ओमिक्रॉन का 2.69 जैसे. Well, of course, RO number depends on various factors. RO number is how infectious is it? How easily does it spread? One person will spread it to how many people? Whereas for the earlier variants, it was about 1.5. This time around, it's 2.7, they say, for the Omicron. But I guess with all these habits that have come into war, masking has become far many more people. Yes, you still find those people who do not care and are not masked. Yes, you do have the anti-vacciners, a small crowd in India, thankfully, not too many. Yes, you have those who get slightly careless. But by and large, India has got used to masks. India has got used to social distancing. You do not get threatened when you tell a person to maintain his or her distance, right? I'm sure all of you can imagine. If you tell a person, "Bhai, aisa zara dur raho to, "Oh, kya hai? Kya problem hai? Kya takleef hai?" Right?
Especially Delhi mein. Sorry, I'm being a bit biased.
That's okay. Delhi mein, yes. Delhi's got aggressive people. So, wo nahi hota. So with all these good habits having come in, and perhaps the nature of Omicron itself, it's got many mutations. And as we all know, mutations are the nature of a virus. A virus is a piece of a DNA or RNA that's constantly mutating, trying to survive. And at times, the mutations will make it less pathological, at times more pathological. So thankfully, nature favors a less pathological. It's interesting because the less pathological kills fewer, so it survives it. That's the way nature is. That's an important takeaway for for us also as humans. If we wish to survive, we must harm others less. Because if we harm others more, then we harm our own survival. So the new variant, Omicron, so we are talking of things getting endemic now. That's because this new variant is so much less pathological. It's very nice to see that most of the people whom we're getting, almost anybody who's testing is coming out to be Omicron positive. In fact, amongst us doctors, we've generally got this, we talk amongst ourselves and we say, test karaya to Omicron mila. Nahi karaya hota to nahi mila. Right? It would have been okay. So Omicron test karane ki bimari hai, kyunki test karaya to Omicron. So that means something very good. That means that the symptoms are very mild and they're present.
Thank you.
Right.
That's wonderful, SP. आप जो बोल रहे हैं, what I have been able to infer is the most common variant we are seeing now is the Omicron, and it's mild. So there's lots of hope. Is that right?
Yeah. So, Dr. Primla, difficult to say whether it's Omicron or not because RT-PCR in India still doesn't differentiate between Omicron and Delta.
Yeah.
But we suspect it's Omicron because having seen Delta is still around in India. Having seen Delta, today I can make out the difference between a case who comes in with Delta and Omicron clinically. The morbidity is much greater in Delta. Of course, that's all presumption.
Yeah.
If we had the proper RT-PCR to differentiate, that would be good. But by and large today, we see a guy and he's got normal flu. So we get lots of soldiers. Asi hai saab, zukam hai. Halka sa gale mein dard. There are some interesting bits and pieces. Dr. Primla, like an ENT surgeon told me that whenever I inspect the throat, I really don't find any congestion out there. And yet they complain of pain in the throat. Okay. So, but that's for us doctors to,
Sure.
talk over a cup of tea. But by and large, the patients, they're good.
Wonderful.
Right.
Yeah.
And
great.
it usually lasts 3 to 4 days. A mild illness like the flu that we all are so used to, lasting 3 to 4 days, and then you're back at it. So I'm happy to tell you people that in India, Omicron at the individual level has become an almost non-issue. As a doctor, I don't mind a case of Omicron at all. Yes, it's a public health issue, you're right.
Thank you. Wonderful. Wonderful. That's great news. While you're there, SPFC, is that intentional? Veer, have you raised your hand or was it just...
Oh, no. I was gesticulating.
No, yeah, I wanted to ask.
There is a question. Before I get you, Veer, and SP, I just want to acknowledge the amount of work that you people have been doing back in India. और वो इंडिया नहीं है, वो हमारे रिश्तेदार वहाँ हैं. So, naman to all of you people who are based in Bharat. Veer, you go for it.
Naman to all of you also, doctors, the diaspora abroad who have come out and stood by us, especially in the Delta wave, when we guys were overwhelmed. It was, there were days when the doctors were in shambles. We guys were in shambles. What do we do? And That's when Dr. Primla and so many others from Australia, New Zealand, USA, everyone reached
Wait.
back, and it felt like,
Sorry, I'm interrupting you. We'll talk about it. We'll get that.
yeah, I guess.
Veer,
So my question is for New Zealand doctors. So we have got lots of respect for the Indian medical system. And when Mr. Singh says that now Omicron to us is like a common flu around and we are just living with it, why is a country like New Zealand still hesitating? Who is advising the government? Do you people write anything or nobody listens to you?
okay,
Doctors
thank
from
you.
New Zealand.
Thank you, Veer. And at this point of time, I'm going to introduce Tanveer, if you can unmute yourself. She's the youngest of the doctors who's come on board. She is a general practitioner working in South Auckland. And if you ever go and look her up on the Facebook, she is a tramper, Tongariro crossing twice. So Tanveer, I suggest you take that question, please.
Hi, everybody. Thank you for inviting me to be a part of this talk. So that's a really valid question, actually, Veer. A lot of, I guess a lot of patients ask us that as well. If it's just a simple flu, then why are we really so worried about it? I guess what I'd like to say is that it's probably more to do with the capability of our health system as well, and the strategy of our health system, but just to reduce mortality. So if we do open everything up, or we do let it be as it is, then the number of cases would be at such a high level where our health system may not be able to cope. Although mild, we do still see some serious illnesses in some of the small proportion of patients. And our government feels that our health system may not be prepared enough to handle those serious cases if the outbreak happens all at once, which like in other countries like India, like it was with the Delta wave. And I'm open to feedback from others as well, yeah.
I wanted to again say specifically, you as a doctor, do you agree with this practice? Because they say 100 people can attend a marriage, but not 101 or 120. Is it just we are taking a precaution namesake, or does it mean anything?
I mean, 100 is always an arbitrary number. So, whether 99 people attend or 101 attend, that's really not a huge difference. But I guess you've got to put boundaries somewhere, and they've magically come up with this number 100 to maybe allow enough socialization amongst the crowd, but not allow enough for Delta to be spreading at a pace that our public health system can't really cope up here.
Those, if I may intervene for a moment, those restrictions are in force in India too.
Yeah.
Sir, those restrictions are in force in India too. Right now also, not more than 50, not more than 100. Those, we all have our questions up with it. But then let's take it as something that's been done for our safety, for our good. Right.
Thank you, SP. And that's beautiful that we're talking about New Zealand, but we've got a little bit of a flavor of India because we've all been watching what was happening in India. And at this point, I'm going to highlight who doesn't know Sandhya. Our star Sandhya, she was here last time as well, always contributing to the community, general practitioner, a YouTube star. It's all yours, Sandhya. And before I get you on, I'm going to highlight Bhavna as well. Bhavna is a general practitioner, and she's well known to the IAmNZ community. She is none other than Mr. Dayalal Bhai Prabhu Bhai Patel's daughter. So thank you, Sandhya and Bhavna. Please take it from here. And now I would suggest all four of you to jump in, and I'm sitting back. Thank you.
Namaste to everyone, and thank you, Primala, for organizing this session, and thank you, Dr. SP, for that enlightening intro. Now, to answer, and thank you, Tanveer, for taking that question of Mr. Carr. Now, I'd just like to go back and highlight a very important point that Dr. Singh made, which I think everybody needs to realize, and that is, although Omicron, thankfully, has proven to be mild, first thing, understand that we are in a different situation now in 2022 to when we were in 2020 and when we were in one. The only reason it is mild is because the vast majority of the countries which are facing this infection have been vaccinated, or if not vaccinated, they have been previously infected. So that's one important thing. Mild is only in the context of vaccination. Second very important point that Dr. Singh made was that on an individual level, Omicron has not been, thankfully, making a major impact. But the biggest impact, and the impact from the beginning of this pandemic, was the impact on the whole of society. And the weakest link, the most important thing that we have to protect, is the healthcare system. New Zealand has one of the smallest ICU capacities per proportion of the population in any of the Western countries, significantly less ICU capacity compared to Australia, which is where I'm from. Now, I think that it is easy sitting at home to point judgment on whatever the government is doing. And I can say that every single doctor who has lived this pandemic and, not only worked from a clinical point of view, but also to educate the public. It is in our interests that we preserve, the healthcare system and just be patient, because, there's no point rushing to, open things and just a lot of other countries didn't have a choice. New Zealand has that choice. And I am hopeful that we will actually come out of this a lot better than many other countries, because the Omicron wave is hitting us with very high vaccination rates. We've got 65% of the people who are already eligible for their boosters have already got it. And we've also started vaccinating children. So, and also schools are going back. So we are going to see more and more spread. So I think, yes, it is frustrating, but we have to make some boundaries so that we don't have exponential spread. And a lot of work is being done behind the scenes to get prepared. Exactly what Dr. Singh said, the impact in India has been less during this wave because they have been prepared. And look at New Zealand, we've had so much time to learn. And the good news is that we are listening and we are learning and we are ready to implement.
Wonderful, Sandhya. Thank you. If anyone else wants to jump in, otherwise I'm getting some questions from the floor. They're sending it to me on the private chat. Bhavna, I could direct this towards you. A lot of concern about safety in children with the vaccines. There are quite a few parents here, and there are some teachers here as well. So do you want to say a few words about that, Bhavna, please?
Well, hello, everyone. And yes, I'm grateful that I've been invited to be part of this as well. So thank you, Primla. And it's a pleasure to meet everyone who's talked, and totally concur with what Tanvir and Sandhya have said. So children's vaccinations, very important. I think the question, Primla, might have been, is what is the safety risk and profile of the children's vaccines? There's been studies done, of course, and for New Zealand to have approved it to be safe in children means a lot, because I think New Zealand's always been in the past quite slow to say yes unless there's been enough evidence. Sandhya has mentioned that for New Zealand to be ready for Omicron to hit us in a big wave, the more people who are vaccinated, the better off the country will be. And one of the important things is around the children. The children are less likely to get Omicron overall compared to adults, but they still can, and they can spread it. And it is important to protect them as well. The vaccine is very safe. No vaccine is harmless, but the Omicron is more harmful compared to what the vaccine has to offer. All vaccines have risks associated with them, but out of the thousands and thousands of vaccines already delivered to children, there doesn't seem to be any negative side effects so far. So overall, the risk profile is actually really, really good. They are, most of our children, before the Omicron wave hits high, are probably only going to have their first vaccines. The follow-up vaccine is 8 weeks later on purpose. A lot of our side effects for adults and children seem to be a bit more intense after the second vaccine, primarily around things like myocarditis and pericarditis. But the risks are low, we have heard from the experts. They have been presenting webinars and seminars and this kind of Zoom kind of meeting where we have an opportunity to ask questions even as a health professional. And we have heard from the experts in New Zealand, pediatric experts, cardiology experts, our immunisation experts. And overall, the risk benefit is our children will do a lot better having had the vaccine.
Great stuff. Thank you. And while you were talking, there was a comment. If it is, Omicron is out, and why are they offering fourth booster in UK? And before anyone else wants to talk about that, of all the days, this I saw in my post today. I wonder how many people have received this. This is from Voices from Freedom. Just be careful, all of you guys. Yeah, this is antivirus, and that's why. Can vaccinated children pass? How serious is COVID? I mean, just be careful what you're getting in your post. Maybe it's trash. Maybe it needs to be chucked away. Right. Thank you.
A very important point about children's vaccination, I just wanted to add, is that getting the vaccination for children has been shown to give a 90% risk reduction in developing the multi-system inflammatory disorder, which can happen in children about 4 to 6 weeks after they get an infection, even if the infection is mild. Also, 1 in 3 adults can go on to have long COVID, and about 10% of children can go on to have long COVID. And you don't know whether that child who's had a mild infection, what the long-term consequences could possibly be. So vaccination 100% is important, not only to protect the child, but to protect other vulnerable family members at home who they can come home and transmit it to. And also looking forward, because this is the new normal for us. If your child is double vaccinated, you're going to be a lot happier for them to continue going to school in a situation where there are recurrent outbreaks. And stop focusing just on Omicron, because this pandemic is not over yet. As Dr. Singh said, the nature of the virus is to mutate, and we can't just expect that it's always going to be a mutation that's necessarily going to be less lethal. That is not set in stone by any stretch of the imagination. So do not, resistance is not futile is a very important message. Wearing masks, washing your hands, etc. And very much, importantly, when we're thinking of cleaning, the primary way this virus is transmitted is through airborne spread. So when you're thinking about risk mitigation, it's really important to think about shared air. So for example, going back to the 100 people at a wedding, if you have 200 people at the wedding, that's a lot more COVID aerosol particles that people are emitting, that even if you've got a mask on, eventually you can inhale enough viral particles to lead on to an infection. So these masks and having good ventilation, whether it's an open window with a fan pointing outwards so that you ensure cross ventilation, and very importantly, starting to invest in something like this portable air purifier, which incidentally...
Sandhya, you muted yourself, I think, accidentally. Yeah.
One portable air purifier, which we spent $300 here at $315 at PB Tech on this unit, is cheaper than one PCR test.
Great, thank you. Thank you. So Sandhya, you were going to touch on
cleaning.
The question was, cleaning. The question was, I want to have a party at home. What do we do about that? What is the preparation I should do as a good host? I'll come to that question later. Suhas, you had a question and you have your hand up. And before I ask you to speak, there was a comment about how do we know the difference between Omicron and Delta? Don't worry about that. That's for statistics. COVID is COVID, treat it accordingly. Suhas, go for it. Tanveer, you can jump in anytime you want to.
I think it's for open to all doctors. This is something that, because my wife, she's a scientist and she works in Douglas Pharmaceuticals, And I've heard about the mRNA technology, which is not very well tested. I mean, right now it's pretty much an experimental mode. mRNA is not a very understood, way of developing vaccine compared to the other traditional methods. So I have two questions here. One is, do we have enough information these days to say that, okay, this is safe for, I mean, I know the general clause that, you can never rule out everything, but is it safe? And the other question is, now since, New Zealand only had Pfizer initially, so I've gone through, let's say, 2 doses of Pfizer. But if I can avoid Pfizer, because for me, Pfizer as a company itself, I don't believe them totally. I have my concerns with Pfizer. Can I, since New Zealand has now opened up for, let's say, Covishield in India, which is AstraZeneca, am I okay to go for my booster with AstraZeneca? So it's a twofold question.
Tanvi, do you want to take that?
Yeah, so I think the first question about the safety of the vaccine, so that's obviously, it was a bit of a rush to get it out initially, but we have had clinical trials which have given us enough evidence to believe that this is safe. Obviously, there's some serious effects that a lot of patients bring up, like myocarditis, and there have been certain people who've had deaths following the vaccine. So those were thoroughly investigated, and there is a small risk of myocarditis, which can lead to some unfavorable outcomes. But overall,
excuse me, Dr. Tanvi, what is myocarditis? Sorry, I'm nervous of what it is.
So myocarditis is an infection around the lining of the heart. So there's been some data that's come up that there's a very, very small percentage of patients who've had vaccines that have had the similar infection, and that's been dealt with within the hospital system. And that's where I guess in my GP practice, I do see a lot of patients questioning me about that infection. So we do need to be open and transparent about it. So yes,
not infection, inflammation.
Inflammation. Yeah. So inflammation of the lining of the heart. So, and that is usually dealt with, and it is mild. However, the safety of the vaccine otherwise is very well proven, and in terms of the rates of death from COVID infection itself versus the side effects from the vaccine, there's clear data that the benefits of the vaccine outweigh the the risks associated with it. So does that answer your first question?
Well, I just wanted to add there, Tanvir, thanks for answering that, but it wasn't rushed. This technology wasn't rushed. The difference in this pandemic is the whole world was affected at once. And for this, we have to thank the USA and the, the funding. There was, miracles can happen in scientific research with the correct funding. And now you are looking at a world where more people have received the vaccination safely than people who haven't. So, blanket statements like, I don't like Pfizer, mRNA technology is not researched. This is clearly wrong. This is misinformation. This vaccine is safe. Yes, a small proportion may go on to have side effects. There has been too much overinflation of, the supposed risk of myocarditis, which is extremely low, affects perhaps younger males more. I have seen in my own practice here in New Zealand, if you, have any symptoms of whether it's chest pain or a racing heart or any side effects, we are reporting every single side effect on that CALM, notification. And most of these, even if we've gone to, go and do an ECG, go and do blood tests to check their heart muscle markers, they self-resolve. I have spoken to cardiologists and we, check them. The one case where the patient did, and it has been proven that they did have myocarditis, the 26-year-old gentleman that did die, he had very significant symptoms which he ignored. Now, that is very unfortunate, and perhaps it points to not enough, public health education around it. But this, and as to your question is whether you would like to get a third vaccine with Covishield, yes, you can, but the evidence has shown that, the mRNA as a booster is actually gives you a better coverage than even some of the other.
If I may put in something here.
Yes, SP, and then I'll let Bhavna to step in, please.
20 years ago, when SARS, MERS, none of these had been heard of, I've seen a 27-year-old para's officer, a paratrooper, the healthiest of the healthy, die of a viral myocarditis.
Yeah.
Right? So these things have been happening all the time. It's just that they were not highlighted. Any viral particle can infect the myocardium or the pericardium or various parts of the body. We as doctors know that. It's just that the general population did not know because these cases were so rare. Today, the media is picking up rare cases and highlighting them. So I don't think those cases should deter us from going in for vaccination. To the person who asked the question, I'm sorry, I forgot your name.
Suhas?
Suhas. It's always risk versus benefit, Suhas.
And actually, the risk is higher if you get infected with COVID of having myocarditis than with the vaccine. The reason the ratio differed in New Zealand is because the government did such a good job of protecting New Zealanders. We had zero COVID.
Forget myocarditis. COVID pneumonia, which is so much commoner, will get you.
Yeah.
Thank you.
I'm sorry about that. And I mean, my reason for not believing in Pfizer is totally different because I've seen the contracts that they've signed with the
Yeah, but
countries.
that's irrelevant to this conversation. So let's not talk about. Yeah.
No, I understand. That's why I don't have confidence in them. If they can't sign a simple piece of paper, then.
Well, I mean, sorry,
So
They make good vaccine. So they might not know how to sign a simple piece of paper, but they make good vaccine.
Can I say here, if Covishield works for Suhas, Covishield goes. That's absolutely fine. Whatever you have, get vaccinated. And I can understand where he might be coming from. A parent, yes, you can be nervous, and it's good. I once heard Oprah Winfrey, and she said it's better to be paranoid rather than not care about your child. So good on you, Suhas, asking the question. He's one of our dynamic persons. He's very well informed. So sometimes information can make you a little bit more anxious and nervous. Good on you for asking the questions.
But also
Bhavna,
the younger age group, 5 to 11, are getting a much smaller dose than the adults.
thank you. So I'll close this question with Bhavna. Your comment, please, Bhavna.
Agree with everything everyone has said. mRNA technology has been around for a long time, but there was the final piece of the mRNA technology we have now that was missing until COVID came. And it is due to countries putting loads of money into it and loads of creative minds, which created the idea of encasing the mRNA in a bubble. So in the past, we've had mRNA. It hasn't been successfully used in vaccinations until someone thought about putting it into a lipid bubble, they say. And the lipid bubble has allowed this mRNA technology, which we've had for a while, to actually make a difference, to actually work, take that last step towards being a great vaccination.
So in simple terms, Bhavna, you're trying to say the mRNA is in a nice, cozy bubble, and that's why it's working, right?
That's why it's working, and that's why
So it's because it's very
wonderful.
Unstable on its own.
Absolutely.
And that's why it's at very cold temperatures.
Exactly. So that lipid bubble is so important, and it is working. And everyone's quite correct. For children, I think all parents should ask questions. I think it's really important that they understand it. But with the COVID itself in children, the illness itself is more likely to cause that long COVID that Sandhya has talked about, which includes things like inflammation of the lining of the heart, inflammation of so many more organs in the body. So in actual fact, risking a small, tiny risk of giving a COVID vaccine to kids is going to improve their health long term overall, rather than getting an illness which will give them long-term complications.
Thank you for that, Bhavna. And I've found that in my practice as well, because I do look after a lot of pediatric patients. I think most of the parents are not really against the vaccine, but they've just heard a lot of misinformation, like, inflammation of the heart, or a lot of parents saying that they've heard of so-and-so and the child fainted. So I think if we just have a very simple, informed discussion that these are the side effects to be expected, these are the ratios of how likely these are to occur versus the risk of getting the COVID. I've been able to convert most of my patients and get their children vaccinated as well. And I think I've been giving them my example because I've got an 8-year-old who's going to school next week, and I was just so glad that the vaccinations came out just before he went to school. So he's had his one on Friday, And I've just been watching him for symptoms of any fever and anything, and he's handled that really well. So I'm sure most of the kids do really well with the vaccination dose, because it is a smaller dose. So I didn't really see a high fever or any other symptoms. So definitely encouraging most of the patients here.
Fantastic. Thank you. And Suhas puts a thumbs up. Thank you, Suhas. But I'm so happy you brought up the question. And there was a note about all of this was so fast tracked and technology. I bow my head to technology. And on that note, and I hope Samir, you're still there, I want to introduce somebody who, when I asked SP, so he said, the intro was, by April 2021, as the disastrous Delta wave swept across India, he, along with Sydney-based techie Samir Sinha, decided it was time to lend a helping hand to thousands of patients denied hospital care back in India. Together, they set up Global Medics, a social media-based telemedicine venture that brought together more than 100 Good Samaritan doctors across the world and more than 1,000 COVID patients in India. He, Samir, has been working online with COVID patients ever since. SP and Samir go hand in hand here, including the present wave of Omicron COVID. So Samir, thank you very much for joining us. And the technology guru, you are an AI man. Please tell us a few words. Thank you.
Thank you. Thank you very much, Primla. That will be a difficult introduction to live up to. So I'll have to work very hard. So honestly, we haven't used much of AI per se. What we have done, I might just, rather than talk about it, I might just share what we are doing. So basically, when COVID Delta wave hit India, so SP and I, we go back a long way. We've been classmates since childhood. And we had been working on remote patient management solutions that uses AI and IoT for the past 6 years. So we decided to come together and help patients in India. So what we did was, Primla, you might have to give me the ability to show, share my screen.
There you are, your co-host now, anytime.
Thank you. So I might just show this to you, what we're doing.
See, I told you, you have a technology man and he needs to use the technology. There we go. So Suhas, good on you. Thank you.
Okay, so I hope everyone can see the screen. So basically, it's a very simple thing. This is just like WhatsApp. The app is called Telegram, and we've just created a group here. This group today has 1,500 people in the group. And we have all doctors like Primla and Sandhya who come to the group and they volunteer their time to help the patients out. So you could see like Lalit comes here, hi doctor, my son is having this problem, my wife is having this problem, we are taking these medications, what should I do? And SP is just logged in and said, good morning Lalit, I think this is what you should be doing. So these are generic questions which every parent, which every person getting infected is asking, and it is beneficial to others as well. The other advantage this has is when COVID changes so rapidly from Delta to Omicron version 2 now, the medical advice, the research around it also changes. And like Sandhya mentioned, what technology has done today is the kind of
we lost you there, Samir. Samir, we've lost you. Bhavna, you're on mute. Samir, we've lost you. We'll get you back in. While SP, do you want to please kindly message him on his WhatsApp?
Yeah, I'll do that.
Thank you, sir. Thank you very much. What I wanted to talk about while we get Samir back, this is really important. We have a lot of family back in India and across the globe. people were worried about how to reach out to people. Like in Gujarat, there have been so many elderlies and seniors whose kids have been out of India. So this technology, what the SP and Samir have created together has been able to support those back home and has alleviated our own concerns. I just wanted to mention one thing. All is not doom and gloom. Recently, Indian community has been impacted with the latest surge of COVID. I won't even say Omicron. Let's not forget, we are possibly the highest vaccinated group in New Zealand. When it's positive, we don't make news. When it's anything other than positive, we hit the headlines. That's okay.
True that.
Let's state we are engaged and we don't shun education. We, as the ethnic group, are really out there asking questions and getting educational sessions and empowering ourselves. Good on all of us. Today's session is reinforcing that we are a responsible group. And that is what we are talking today. Ask questions. Do your kids need to be vaccinated? You're going to host a party tomorrow? What is it that you should be doing? That's what we have to be thinking about. And that's where Sandhya is.
Mr. Samir is back online.
Is he?
Yeah.
Yep. Okay. Oh,
I place too much trust on technology, and it ditched me.
You might give Suhas a chance to say a few words there, Samir.
No, I think I'll come back later. Please carry on.
No. Go for it. It's all yours. We were just filling in time.
Okay. So basically, there's this group where doctors come in, and these doctors are volunteering their time. So normally they have busy lives. They have to look after patients as their day job. But basically what they're doing is they are volunteering their time to provide that guidance and advice to patients in the Telegram channel. So if you have any specific concerns around, your child having certain symptoms or what kind of vaccination you want to take, this is one of the places you can come to. Normally, we have doctors from 9 different countries. So very often the load is shared amongst 130 doctors from 9 different countries. So often the wait time is less, but it's when people are not, yes, it's called Global Medics for COVID. And I will share that link with you. Please feel free to share it around. And if you ever miss out on that link, we also have a website now, globalmedics.ai, so you can get all the information and links there. So please feel free to reach out. This service is free. It's a community-based service, and you can access it from your phone or from anywhere else on the desktop or your phone. We also encountered another problem where, like I have my parents in India, they were alone, so I was worried about them. Yes, exactly. That's the link, globalmedics.ai. And if you want, so there are two offerings we have. One is this Telegram channel. The other is we are building another set of offerings where if we have parents in India and we want to look after them, is there a way we sitting in Australia, New Zealand, and other parts of the world, we can look after our parents using an app? So we are about to release this app where we engage people local to the patient, your friends, your relatives, etc., and the patient themselves. They could be entering their vital signs data, their symptoms in the app. And that app is, that data is published in a dashboard to a group of doctors and family members across the world. So you could have your parents in a remote village in Uttar Pradesh, and a cardiologist from London and a nephrologist from Sydney could be monitoring your parents' condition in real time, and you could be part of that care team as well because you have access to that data. So that's something we're going to be launching shortly. We've built the app. We're just going through the testing. So if you want to be part of an early access, have early access to this, if you scroll to our website, there is a contact sheet. So early customers, we are again trying to make it for free, available for free, so that people can try it out and benefit from it. So these are the two offerings. One we call a virtual outpatient, which is Telegram channel. And the second is what we call virtual inpatient, where you can look after your parents in another country. So that's what we've been doing. Thank you very much for that, Primla.
Fantastic, Samir. Thank you very much. And this is how two services have worked so beautifully together. And I have to say and acknowledge here, SP does most of the consults, but we all try to chip in. I've been a little slack. My apologies, but thank you for what all of you are doing. Fantastic. Thank you, Samir, for stepping in.
Thank you. Thank you.
I just wanted to touch on another aspect, and people, please ask questions if you have to. Please don't forget family violence. It's a major, major deal during a pandemic. And I request all of us, all people who are in the part of the community, as mums, dads, teachers, please have a very low threshold of looking out for any red flags for violence. Unfortunately, New Zealand is fabulous, right? But we have the doubtful distinction of being at the top of the list of the countries having family violence. We top the developed world, which is very, very unfortunate. And I was looking at the WHO website, 20 to 33% increase in family violence over the last 2 years, 20 to 33%. And we know as Indians, we don't even talk about it. So can all the teachers who are part of this conversation today just have a very low threshold looking out for everyone? Ask the question. If you ask, you'll be surprised what people will be telling you. That's something I really wanted to talk about. Just a quick one. Bhavna, what would you say? I want to invite friends over for dinner tomorrow. What should I do? How do I prepare my home?
In red, I guess red traffic light.
Yep.
Yeah. I would ask they wear masks. Well, I'm a little bit fussy, but I would suggest that we have an early dinner. We try to have it outdoors if we can. Otherwise, I will be having dinner in a room that can be well ventilated. I wouldn't invite too many people. I'd restrict it. Similar to what Sandhya has been talking about, to reduce the transmission of any virus, masking, less people breathing into the air, well ventilated so viruses can die, evaporate, go away, don't land on us. Lots of hand hygiene. Yes, we will have to eat. And so in the room that we are eating, just fans, just something to keep us free from catching each other's aerosols.
Sure, great stuff.
Sandhya might have been talking about this a bit longer than I have, but I don't know if she's got anything else to add.
Yeah, no, you're fabulous. And I'm going to get Sandhya in here because I wanted to talk about, it's going to be hot. So when do I switch on my aircon and when I should switch it off? Should I leave it on? Sandhya?
Okay, excellent question. And thanks, Bhavna, that you've covered that really well. Yeah, look, this is, and I've done a video on this if you want to look. It's on my YouTube, which is the last talk I did with Primla, which is managing risk in a living with COVID world. And everybody has to understand that there is no such thing as zero risk anymore. But by using the multi-layered strategy that we have available to us. And I would say that you have to think of it as a vaccines plus approach. And the countries that have done the best with managing COVID and getting back to normal life, you've got to look at countries like South Korea and Japan, where despite, this Omicron being omnipresent everywhere, they've actually managed really well. And where they have managed would come down to the fact that they have excellent discipline with things such as masking, which, as I explained to you, not only does it protect each other, it is in our best interest to reduce on every occasion the number of COVID aerosols we are inhaling, because a reduced dose correlates with a less severe infection. So, and the other thing to remember is that it's not a case of, okay, I'm out to get my Omicron infection and then I'm done with, because in many countries, people are getting infected again and again and again, second or third time, and within a short frame, like 4 weeks later. So unfortunately, it's a new normal that we have to embrace. Number one, when we look at our vaccines, so it's vaccination, number one, and getting your booster as soon as possible. So if I'm having my party, first of all, I want to know that the maximum number of people who I'm inviting are vaccinated, if they are eligible to do so. And if there is anybody that's vulnerable, then I need to know if I'm actually ready. Number two, obviously, if you're having a party, you don't necessarily want to, you're going to be eating, so masks are going to be a little bit difficult. So if you can have that party outside, have it outside, because it's all to do with, dilution of these particles with fresh, filtered or flowing outdoor air. So fresh air means having first of all, being outside is better than being inside if you can. If you can't be outside, then having as many windows and doors open and ensuring cross ventilation. When it comes to your fan, just a little fan like this pointing out, so the fan is pointing, facing out the window, will help with cross ventilation. In terms of air conditioning, you do not want your air conditioning mode on recycle internal air, because that's going to increase your risk. Now, there's two different types of air conditioning units. You have your HVAC, which is heating, ventilation and air conditioning. Those units, you can actually use ventilation, but other just standard home ACs don't have that. They tend to, recirculated internal air. So it's always preferable. I mean, you could have the AC on, but you'd want to have the windows open as well. Even if it's winter, even if it's cold, even the UK did a ad campaign where they said opening the windows for even 10 minutes every hour will help reduce the viral load of that actual room. So you've got to imagine everybody's releasing this fine spray. Okay, this is just some Glen 20, which will help clean your surfaces, which is good if somebody's actually infected. But rather than madly cleaning your surfaces, you've got to shift your thinking into cleaning shared air. And I think there hasn't been enough on these portable air purifiers, which are affordable. You can use in your workplace and at your home if you've got a party and you are inside. They are effective in filtering 99.97% of viral particles that are emitted in a room. So they are an excellent extra layer of protection and will protect everybody. And it's not just, and clean air is not just about COVID, it's about all sorts of illnesses. I mean, to be honest, in the last 2 years or since the pandemic, I have not actually come down with a viral illness, touch wood. Whereas every year when I was practicing, when I didn't wear masks, I would have a terrible infection at least once or twice a year, because we just purely didn't, that purified all those, viruses or bacteria that I'm inhaling when I'm examining people in a small unventilated room. Now I see patients, I have my mask, the patient has their mask, the window, I have an open window, plus I have an air purifier, which the air purifier placement is best away from a window in the area of the room where there is, less, clean air that's coming in.
Thank you.
Yeah, these are really important tools. So we don't have to feel like, we're powerless. There is a lot in our power.
Wonderful, Sandhya. I know you are you're a fountain of knowledge, and it's very, it's amazing how much you can deliver. Fantastic. Thank you very much. A question to Bhavna. I've had my I was infected, I had COVID, I came COVID positive, I haven't had my booster yet. What do I do? Shall I have a booster? Yes. When?
Yes.
How long
so
should I wait?
So as an adult, you should get your booster 8 weeks after your, 4 months in New Zealand after your second vaccination. It is important to get your booster even if you've had a mild COVID, because as Sandhya has pointed out earlier as well, these different strains can reinfect us. And so, yes, I would go ahead with the booster. It is 4 months now after your second vaccination. Some people have had 3 doses if they've had some underlying medical conditions. And so then it's 4 months after your 3rd dose.
Okay.
And the reason it is that time frame is to reduce risks of side effects of having another booster as well. I did want to, I forgot to.
Sorry, actually, that question that you're asking is when you've actually got infected, but you were due for your booster. Each country is changing their rules, but we haven't come to that situation here in New Zealand, but we will. ATAGI in Australia is now recommending, as long as you're recovered and you finished your isolation period and you don't have any more symptoms, then you can go ahead and get your booster. What I did read for children, if they're in that circumstance where they, at this stage, children aren't getting boosted, but if they get infected between getting their first vaccine and their second vaccine, you may want to wait 4 weeks post-recovery, because generally if you are to get multi-system inflammatory disorder, it will manifest itself 4 to 6 weeks after the original infection. But each country has different rules around this.
Thank you.
But yeah, that's the general consensus.
What I'm seeing here is, sorry, I don't want to be rude. I don't want to be sounding like I'm talking on top of people. But what I see here is Tanvir has written 2 weeks post-isolation of COVID positive case. If COVID positive, 2 weeks after, get your booster. Would that be consensus? And what I'm adding here is from Sandhya, as long as you're symptom-free. If you're well,
Symptom-free. Yeah.
Then go ahead and do it. Suhas has raised his hand, but I want to acknowledge, SP, you're doing us a great favor, sir. You've been answering questions on the chat, so well done you. Suhas, go for it.
Yeah, no, I wanted to point out the same thing. There's a lot of nice discussion happening on chat. So if anyone's not following the chat, the doctors are replying to your questions. So please keep yourself on top of that as well while you're listening to some great doctors speak. Thank you.
Thank you, Suhas. Thank you for keeping us all on top of things. One quick question again, and I might get Tanvir in here. COVID has entered my home. I'm self-isolating, and I've got others, there's a chain reaction going to happen. Others are going to be infected. Now, what do I do with my rubbish? How do I dispose of my rubbish? Tanvir, do you want to take that question, my dear?
Yeah, that's an interesting one. So I think I would need to probably check this with the local ministry guidelines, but I'd assume that it has to be disposed in an infectious bin. Is that correct? If I get other panelists to chip in.
I mean, if you are infected at home,
yeah.
I think the advice is basically if a family member tests positive, then do everything in your power to protect the rest of the family members. So if you do have the option of, isolating in a room and you have your own bathroom, then that would be ideal. And as I've talked about, ventilation is really important. Everybody in the family in common areas should be wearing a very good mask. And I've just done a video on masking and explaining the difference between the N95s. And it would be good to get yourself some KN95.
Sorry, Sandhya, I'm interrupting you there.
Yeah.
COVID is already in the house. People are infected. How do you get rid of the rubbish?
So getting rid of the rubbish, so you want to have a good stock of plastic bags. So the infected person, obviously, you keep their rubbish within their room, wrap everything, in that plastic bag, their tissues or whatever, and then you would just dispose of it, tied up into the, regular bin.
Yes.
In terms of infected waste, we're talking about, inside a clinic or a general practice, it's different.
Yes.
So yeah, and and practical things you need to think about is like when you're going to be serving the infected family member their food. And the other point about entertaining, to go back, a lot of other countries where New Zealand's not at this yet, they're doing things like a rapid antigen test just before going out, because they can change very fast, and that's how the UK were having free access, and they would, before entertaining, going to somebody's house, and we might get to that, where you do your rapid antigen test, which is your self-test on that thing that looks a little bit like a pregnancy test.
I might, sorry,
yeah.
Sandhya, I might have to call Jacinda's partner for that. Hey, I may not have
Yeah.
access to that, right?
Well, none of us have access to that currently, but these are tools which are going to become sort of normal. And importantly, forget the positive rapid antigen test. If you are sick, stay home. Do not spread your germs. Yeah.
Wonderful. Quick question, SP, I'm not ignoring you. You're doing a fabulous job on the chat, sir. Please join in. Natural versus acquired immunity, which is better? So for people, general people, it is, I got infected, so now my body has become immune, so that is natural immunity. I'm not infected, I get a vaccination, and now I have been immunized. So that is artificial immunity. So there's a lot of debate happening. Is there a consensus here? SP, I'll ask you to take this question, sir.
There has been this debate going on about natural versus acquired immunity, or natural versus artificial immunity, so to say, due to vaccination. Artificial immunity has the drawback that you're using a very few antigens. Natural immunity has the advantage that there are multiple antigens on the virus to which your body is developing. However, artificial immunity has the advantage that it's usually given, the vaccine is given with along with substances called adjuvants. These adjuvants potentiate the immune response.
So you're basically saying when I get the vaccine, there is a higher chance that I might be able to fight the bugs better.
Not really, not really. I'm not convinced, because the vaccine carries only one antigen. Okay. Right, the virus has n number of antigens on its surface. When we get a natural infection, our body develops antibodies, T cells aimed at multiple 10, 20, 30, 40 antigens on the virus surface. So the next time another virus comes along with some of those antigens missing, the body can still latch onto the balance of the antigens and destroy those. Whereas with the virus, with a vaccine, we're looking at one single antigen, the spike protein, that's it. Right?
Okay, so
I've always had this belief that new data coming in from the US now is suggesting, the CDC is suggesting that natural infection confers superior immunity compared to vaccination, and that makes perfect sense. That makes perfect sense.
I disagree.
Which does not mean, you might disagree, Sandhya.
I strongly disagree.
That makes perfect sense. Scientifically, it makes perfect sense. Okay. That doesn't mean that you go out searching for the natural infection.
I think the key point is that the natural infection, you put your body at risk of all the side effects of that natural infection, which is death, which is long COVID. And by getting this immunity via vaccination, I think saying artificial is incorrect.
I totally agree with you, Sandhya. I totally agree with you.
I know that you do, but for the general lay people, I actually think that, and the reason that we did get the vaccination is because through infection, getting immunity is not consistent. Different people will mount a different immune response. Some people will not have as long leading response as other people.
All right,
fantastic.
Sandhya, you've made your point.
That, Sandhya.
Yeah,
but I was never recommending.
No, I'm just saying other people might misconstrue.
Yeah.
Sorry, you let me finish saying what I'm saying, Sandhya. So what I was saying was,
I love the passion here. It's almost like Arnav Goswami show.
It's not
great stuff.
Nobody wants. Yeah, exactly. It was turning into an Indian TV channel political discussion.
I'll be there.
Okay, let's have it here.
So we do not recommend getting infected, because getting infected carries all the risk of infection with it. However, For those who have been infected, it's very likely that their superiority or their immunity might be superior to those vaccinated but not infected, right? That's all I'm trying to say. However, that's in no uncertain terms. Please do not try to seek an infection as an alternative to vaccination.
Thank you.
Because the infection may kill, the vaccine will not kill.
Thank you, sir. You know what I'm really liking is we are being honest. There are certain things we know, certain things we are inferring, and certain we are not sure about. So basically we're saying, we think this is how it should be, but it doesn't mean do not get vaccinated because vaccines still protect.
Yes, it still protects.
Yeah, thank you. And that's the bottom line. Fabulous. Thank you, SP. And you guys, Sandhya, you brought in the passion there, which I really, really like. That's
and
fabulous.
I think actually on vaccines, because I think everybody is uncertain, is that even if you're vaccinated, and just remember that there's not many vaccines that give a sterilizing immunity, which means that you cannot contract the infection, but that's the next step. And we've already seen a massive development within 2 years, which you would never see, which thank God for science. Don't believe politicians, believe scientists. Now, the next step they're talking about is pan-coronavirus vaccines so that, you know, you can basically, as Dr. SP is saying, recognize all the facets of the vaccine and don't get infected in the first place. The second area, which is very exciting, is nasal, vaccines or technology, where a lot of the reason where people, my understanding is, where people are getting the infection despite being vaccinated, is because the vaccines don't actually work at the nasal upper respiratory tract level. So the virus may enter, but it's only when it enters your system, that's when the vaccines kick in and they're like, oh yes, I remember that, and start fighting it. So the next frontier is vaccines or technologies that can prevent up in the nasal cavity, and which is why another very simple thing which I do, has been my practice since the beginning of the pandemic, is when I come home from outdoors, I just spray my nostrils with a simple saline nasal spray, rinse the mouth with a dental antiseptic or a salt water, and just give the tongue a brush. And if I have any inhaled viral particles, hopefully that would help reduce that viral dose I've inhaled. It's not going to cause harm. You'll have, minty fresh breath. Everybody will love you, and perhaps you'll actually decrease your risk.
Thank you very much. Fabulous. Again, a couple of things. Suhas has put up his hand, but before I go to Suhas, can I request Paul Patel? Paul, if you're still there, chip in, please. And SP, you're still doing a great job. You're answering all those questions on the right. And I see Bhavna has said, shouldn't have a vaccine if you have a fever. Trust your healthcare professionals. That's the bottom line. You see these discussions keep on happening on WhatsApp, and we're trying to get the crux of all that information and passing it on to people. So can I request Paul Patel?
Yeah, thank you, Premla. First of all, I'd just like to say, Premla, this idea of this Zoom meeting, it's been fabulous. It's just a shame that we didn't have any more people, because a lot of these things that are discussed here, there's lots of probably other questions that the ones on the panel here might not even have heard of from the members of the public or the Indian communities. But, Tanvir, Sandhya, Bhavna, and obviously SP all the way from India, and Samir, it's been great having you professionals, and it's really good to actually, I think the advantage we have in this one is because we're all Indians. And I think that makes a big difference in the type of questions that have been asked and answered. And as you so rightly said, Premla, we haven't got all the answers. The medical people haven't got all the answers, nor have all the governments around the world got all the answers either. And some of the questions that have come up are sort of in what I call a repetitive line, because we are still going through this, even though we've had 2 years of it. The only thing that I can say is what Sandhya and Tanvir and Bhavna and SP, we've got to get vaccinated. That's the first thing. We have to get vaccinated, and we've got to keep ourselves safe before we keep our families safe and our friends and everything else safe. There are still things that are going to happen in the next few weeks. Things are going to escalate. We're going to get to another stage where we'll be trying to do things from home, a lot more from home. So listen to all these things that are coming up and take heed of what they're saying. But and thank you, Primla, for giving me the opportunity. Thank you.
You're welcome. Thank you for joining, Paul. Thank you very much. On that note, I know there are a couple of people who've raised their hands, but I want to say there was an announcement that we'll have 50,000 daily cases by Waitangi Day. Let's play our part to prove it wrong. Mask, immunize, social distancing, and keeping all these, these are the small, tiny pearls and gems that we're getting today. Let's use them. We'll keep the infection at bay. Suhas, it's yours.
Yeah, Woman, my work needs me to travel, so I'll be taking this flight very soon. So very recently, I've been seeing all the airports being the hotspots, for obvious reasons. So my question is to the doctors, like, what is the best I can do to take all precautions, especially with type of masks and hygiene habits? That will be a good guidance. Thanks.
Tanvir, do you want to step in?
Yeah, sure. So I think that's a really practical question because all of us will start traveling soon. So the initial precautions. So my parents just went to just traveled to India over the weekend. So I'm pretty fresh on this issue. So definitely have your COVID passes ready. You want to travel with a couple of extra N95 masks. Using gloves as well. So when you are traveling, try and do not touch, try and minimize the touch of any surfaces. If you do have to change gloves, sanitize, and then, use gloves again, you are permitted to travel with face shields as well. So if you can get hold of those, you can use the shields as you go. I have seen some of my patients also travel with PPE on as well. So those are some of the basic precautions. And obviously, the main ones, keeping your distance in the queue. So if you're lining up for your baggage or, having a 2-meter distance and having your own water bottles ready and things, so you're not having to share common places. Those would be the main ones. Yeah.
I'll just add to that. If you think about it, so the most important thing is having a really, really good mask and also eye protection. So don't forget your eyes. The most risky time is if you are going to eat or go to the toilet on the plane. So if you can avoid either, for example, if you have a water bottle, if you have a straw, then you can sip it through the mask. If you are to use the toilet, if it's a long flight, I would say make sure that that door is open for a little while and, flush with the seat down because, there are fecal aerosols, and same when you have a party at home, the extractor fan in the bathroom. So yeah, just really think about, and that's why on domestic flights now they've stopped serving food, because anytime, and same for your children when they're at school, tell them when they're at school and it's lunchtime, eat outside.
Thank you. That's really nice. One more point I can add here is sit if you can get the window seat, sit by the windows, because when people are walking, you know how they say, go to the bars, but if you're standing, then you need to have your mask on. So just remember, if you can, get the window seat. Hey, so have you? Yeah.
For the eye protection, are we just saying safety glasses or?
You can use shield as well. Yeah.
Yeah, or you could just have your. I told my friend, when she went to India last year, and she forgot to get eyes, so she wore her sunglasses the whole way back. She said, "Everybody stand up in the plane, but Sandhya told me not to take the glasses off." Thank you. But she didn't get COVID.
Whatever your doctors are wearing, Suhas, and I think we could actually have a cottage industry for eye protection.
Even if you have glasses, it's fine. Yeah. Just protect your eyes. Otherwise, they have funky, goggles and face shields. You can actually, I only recently discovered the hardware store. The PPE section in the hardware store has lots of P2 N95 masks. So it's not just your medical grade, the ones that the builders use. So P2 is more of an industrial standard. N95 is a medical standard. The other ones to look out for is KF94 is a good one to look out for because that's a Korean classification, and they have less counterfeit in the KF94 than the KN95s,
Sandhya,
which are a Chinese one.
Sorry, I'm interrupting you. Do you mind writing it in the chat so that
I
everybody
just
gets
typed
it?
it.
Thank
Tell
you.
me if it's wrong.
Okay, and before we can keep rolling. I have always believed it doesn't matter about numbers, it's the quality. And even one person, if gets something out of this meeting today, I think we as healthcare professionals feel satisfied. And I think I speak on behalf of everyone here. So on that note, we'll keep going. There is no end point to this meeting today. Everybody has an opportunity to ask whatever questions they have to. But I want to say thank you to SP. SP has to go. And I really, really want to say how obliged we are for what you are doing there for Ma Bharati and for your contribution in all aspects. You're an ex-4G representative. So हमारी ओर से आपको 2 बारी नमन है, SP. Thank you, and thank you for joining us.
Thank you, Dr. Primla. Thank you. And thank you, everybody. It was very nice being with you, all of you, for the last 1 hour plus. And I see some very interesting questions. I would love to be here and carry on with the discussion, but unfortunately, I have to go. And all the best, everybody. Thank you.
Thank you, SP. Thank you very much. Thank you. Thank you from all of us. Thank you. Okay, there's a question here. Should I be allowed home detention instead of MIQ when I'm fully vaccinated? Detention is a strong word. Hey, Bhavna, do you want to take that?
Detention is a strong word. So we're going to be calling it home isolation. So as the numbers of Omicron are going to climb significantly, even if we are fully vaccinated and have Omicron, government will probably, Ministry of Health won't insist on MIQ. There is, whenever someone has a positive result, public health does get involved. They ask lots of questions. If you are vaccinated, you will still be asked to isolate and most likely isolate in your home. At the moment, any positive case of Omicron or Delta or COVID is going to be asked to self-isolate for 14 days. And any close contact of a positive case will be asked to isolate for 10 days. Though that length of time was reduced temporarily, but with Omicron here, they've increased it. Most likely, as the numbers significantly increase of Omicron, 10s, 20s, 30s, 40s, 50,000 a day, they may reduce the time frame of that isolation. But home isolation is coming. There's no way we can all fit into an MIQ facility if we are positive.
On that note, thank you, Bhavna. Fabulous, great discussion happening. I just want to acknowledge our elderly, who are the most vulnerable, are doing the best because they're following the rules. And for once, we who are in our 40s and 50s and touching 60s, we need to be following them in their good behavior. The less than 30-year-olds, they have the best resistance, but when they crash, they really crash badly. So that's what I've understood out of this. So hats off to the seniors for setting up a great example, and this is amongst the Indian community as well. It is 40, 50-year-olds who really need to be more careful, and it could be because we are the one who are most, we go to the shopping center, we go walkabouts and do stuff. So we have to really take care. I would have loved to say, I'm a feminist to some point. I would have said, women are doing better than men. Unfortunately, not this time. It seems women tend to get more infected than men, just by a little margin. So let's change that as well if we have to. Okay, that's some numbers that I picked up from the Ministry of Health website. And as I said right at the beginning, Indians have one of the media persons was talking to me and he said, yeah, I'm seeing I do not know how they get this, but Indians are 100% plus immunized. So But when it comes to vaccination, we are tagged as Asians because that skews the number up that everybody's doing great. This Omicron, this latest episode event that has happened, quite a few centers have been highlighted, which includes Mahatma Gandhi Center, our own Diversity Center, Pukikoi Indian Association. So we are all in this together. So we all have a responsibility to work better together. I also want to acknowledge the amount of some amazing work that our volunteers in the community are doing with food packs, putting their lives at risk and going out and serving the community. I do want to acknowledge them. Next question, if anyone has, we'll go. I just needed to put that in before people say need to go. So Has, is there any question that we have missed? I think we've answered.
I just want to say one thing, Primla.
Yes, yes.
That the take-home message is resistance is not futile and preparation is key. So the more you are prepared, the less you will be stressed. The less you are stressed, the better will be your immunity, because the worst thing for your immunity is being in a constant state of stress. Okay, that increases inflammation. So once you understand the new normal, the parameters in which you can lead your life and what your risk appetite is, and you have all those things at home, and it will be a reality very soon that people will get infected, that, you know, you've got your Panadol, you've got your Vicks, you know, you have a pulse oximeter, you know, you have some ready cooked meals, you have enough groceries, your rice, your atta, your whatever, to be able to self-isolate. And currently it's, you know, up to 10 days after the last person in the family tests positive. So it could be a lengthy time that you'll be at home. You have those people that you can fall back on, because it's these practical issues, which is what you've not thought about, like how you're going to set up your house, where's your sick room going to be. These are the things which you should start thinking about now. So as long as you are prepared, you can't be caught unawares, and, you know, we'll all get through this. We'll be fine. There is a lot of hope.
Wonderful, thank you.
I think I just want to add to that it does feel a bit isolating and lonely getting the COVID infection, but we just all need to support each other. And if you do need to reach out to help, so your doctors will be available. Your most of the GPs probably do have, I know for our GP, I can say we do have a mental health support system set up as well. So we do need to be, you know, reaching out for help when we do need it, so that during COVID, as well as looking after our physical health, we are looking after our mental health as well. And maybe have, you know, contact with some friends as well. So maybe, you know, you don't need to be, when you're infected, you do have some outside contact where you are keeping distance who can help you through this, so that you're not feeling very isolated and lonely. Yeah.
Great words, thank you. Bhavna?
Agree with everything everyone has said. We are all going to get Omicron. It feels like it. Being prepared is important. Looking after each other is much more important. So please reach out to loved ones. If you do end up in home isolation, talk to people, FaceTime people, call your GP, talk to the nurses. Just make sure you're not feeling lonely. It's hard work, and with families where there are more people in the home, like Sandhya said, just get prepared now. Where is that sick person going to be? Where is the positive person going to be? How are we going to manage the food, the cooking, the cleaning, keeping everyone safe but supported? No blaming, no pointing fingers, no nothing. Just, we are going to get through this, but we have to do it together and safely.
Yeah, I don't see any questions in the chat, but if I think the doctors did a great job replying to the questions as they came. However, if people have questions, I think it's better to open the, just ask them to ask it in person rather than type it now.
Thank you. I think it's been a long session, and as I said, it's the quality that matters, and we've had an absolutely top quality people join in and giving their time, saying thank you to Samir for your lovely words, Samir, and the work that you're doing. Thank you for sparing your time. I know you're a very busy man. Sandhya, Tanvir, and Bhavna, not even once you say no. Primla says, I want you on, and you say yes. And I really want to acknowledge Tanvir here today, our youngest, flourishing, blossoming young general
Oh,
practitioner.
thank you so much.
Bhavna's and mine ex-student and out
Yes.
there in the community.
Learn from the best, yeah.
Thank you. That's the best compliment I've got
It
today.
is lovely.
Oh,
Thank
it's
you.
true.
Thank you, Premila, for organizing and having the foresight that this is
Absolutely.
necessary.
Yeah, thank you very much. Samir, you've got yourself unmuted. Do you want to say a word? And Samir? No? Yes?
Yeah, just thank you very much. Really appreciate you putting it together, getting the community together. I think it might be worthwhile having a follow-up session as well, and so that people know that they are doctors, they can reach out. There's a lot of information that people can get. So it'll be awesome to have a follow-up session sometime in the near future.
Thank you. Thank you. We will definitely do that, and I'll
Thank
be
you.
pinging everyone. Thank you. And Paul, thank you for coming. And can I ask Suresh Bhai, our Vice President for IAmNZ, if you want to say the last golden words, sir, and then we will close the session. Thank you.
If I may add just one more sentence.
Yes, sir.
Yeah, it's a good thing that we've recorded, and this program is going live on our Facebook channel. So don't be disillusioned that this is the number of people. There are other people on Facebook that are watching it, and also this video recording will be in Facebook. So I request the participants, if you feel like you want this information to pass on to your family members, please feel free to share that. Thank you.
Thank you, Suhas. You've got my back. Thank you, man. Suresh Bhai, you're on mute. You're on mute, Suresh Bhai.
Here we go. How's that?
Oh, perfect, loud and clear.
Very good. First of all, thank you very much, Dr. Primla for that. And just like to say, it's been an awesome session. I've been sitting back here listening. I did have a question, but I think it was answered by Dr. Palna. Yeah, just like to highlight that many of the Gujarati weddings do provide dinner. And as Dr. Sandhya was saying, being out in the open air is an ideal way, and I've attended one recently. But I think in a confined space, I think the management of that wedding would have to reorganize with a flow of air, which is highly critical by the looks of things. And I hope that this message will get out there to those who are thinking and planning of having a wedding of that nature in a confined space. So yeah, here's a lesson learned for everyone. I'd like to thank all the doctors. Thank you very much for the input and the expressions, and those who have put their questions forward. I hope they have been answered to your satisfaction. And perhaps we look forward to another session. They're very interesting. Thank you.
Thank you. And Paul, you've got you're unmuted, so saying bye to you. Thank you.
Thank you, Primla. Thank you for all the work you did to bring everybody together. More we need to do on it.
Thank you. I think I hear Jyoti there, so thank you. Thank you for joining. Namaskar. If anybody wants to say a few words, it's on. Otherwise, sabko namaste. Thank you very much for your time. Namaskar. Bye-bye. Thank you, my lovely friends. Thank you.
Thank you all. Bye-bye.
Thank you all. Thank you, Primla.
Bye-bye.
Thanks.